I'm here today with an urgent call to action for people on California's North Coast, which has as its epicenter the city of Fort Bragg of about 7,500. This is an urgent call to action about a meeting this Thursday night at 6 o'clock, a meeting of the Mendocino County Healthcare District Board. And if you live on the North Coast, you want to be involved with this meeting and you want to know more about the Mendocino County Healthcare District Board because your health may depend upon it. An urgent call to action. Please hear it as that. It's not here. I'm not here to tell you what to do or what to say. I'm here to ask you to please get involved in your hospital and your health care. The hospital here on the coast has a long, shaky history. It's been around for over 50 years, but it's always been shaky financially. This is for many reasons. Some of the reasons have to do with embezzlement. I was personally involved about 20 years ago with 3 local citizens at uncovering embezzlement by the CEO at the hospital. We have also suffered from mismanagement. You might ask, how did the board allow embezzlement to go on for years? Well, there was mismanagement and there was incompetence. Good people trying very hard, but way above their skill level in running a $55 million business in a little tiny town. Other reasons for the hospital having trouble? Economy of scale. Hospital chains can buy in bulk, huge amounts. They can hire in bulk. We have to make small purchases. You lose money that way, or it costs money. It costs more money to operate that way. Another reason is insurance reimbursement. We're a poor community, loving and wonderful and marvelous, and I love being part of it, but we're financially modest. And so a lot of us are on Medi-Cal, and Medi-Cal does not reimburse the hospital substantially enough. So there are many reasons we're shaky. And so those reasons direct us to get involved with a larger chain, a chain that can take us under their wing, and we can buy things with the economy of scale, and we can take advantage of their larger business and still have great services. So we tried that. After the hospital went bankrupt a few years ago, we affiliated with a group called Adventist. It's a religious organization that has a hospital chain. Many people had feelings about it. But we did it. We affiliated with them. The reason I'm asking you to get involved now is because the Adventists have asked to renegotiate the lease. That is a big issue that you need to know about. Why is that? Because there are times in history when a geographic area, a country or a small town, reaches what's called an inflection point. It means a point in direction where things could suddenly go in a very different direction. The town of Fort Bragg and the North Coast could go in a very different direction if we were to lose the hospital, or if too many CERT were cut away from the hospital. That's why you need to get involved. Now, the Adventists have already cut a couple of services. OBGYN, because they're anti-abortion. And they're thinking about, we're hearing, cutting the oncology service, but that's not for sure. All these are reasons to get involved. The inflection point will be at the end of the negotiation for this lease. We're going to know what kind of hospital we have. Also, we have a retrofit coming up. Did you know that? It's been put off, kicked down into the future. What is it called? Kicking the can down the road for decades. Coming up in 2030, we have to have a retrofit or a new hospital. That's only 6 years away. Where's that money going to come from? These are reasons for local people to get involved. So I'm reaching out to you. I hope you'll get involved. Go to the website for the Mendocino Coast Health Trust, attend the meeting on Zoom, or attend it locally. Get involved. Be involved in your own health. Thank you for listening. Until next time, this is Dr. Richard Lewis Miller reminding you that good health is worth fighting for, and it's essential for life, liberty, and the pursuit of happiness.